Next, select the HCPCS code for pacemaker, dual chamber, non-rate responsive. So here the question is about pacemaker dual chamber. So first you need to be aware about the difference between single chamber and dual chamber. Single chamber pacemaker means they will insert electrode only to one chamber. Okay, it will be like right ventricle. Coming to dual chamber, here they'll utilize two chambers. It will be like right atrium and right ventricle. Okay, so we will be considering it as dual chamber as the two chambers have been utilized. And what is non-rate responsive? Like it's a type, it's the function of that particular pacemaker. So few will be non-rate responsive pacemaker and few will be rate responsive pacemaker. So non-responsive pacemaker means like that particular pacemaker, it will not have a function, or it doesn't adjust the pacing rate based on the body's activity levels or physical demand. Okay, coming to rate responsive pacemakers, the function of rate responsive is like they will be automatic. Okay, they will have the sensor, so that sensor will detect the movement or breathing or any other factor, and it does adjust for any variations. Okay, so here our question is non-rate responsive. You can see the description. C2619 is dual chamber non-rate responsive. C2620 is pacemaker single chamber. Okay, we having question regarding dual chamber and non-rate responsive. So answer is C2619. Option A is correct. Next question, non-Medicare patient with type 1 diabetes is prescribed with continuous glucose monitoring to track the blood glucose level in real time. Patient rented CGMS for 4 months. What is the correct HCPCS code? So here, as you can see, patient has opted CGMS for rent. Okay, check this code description S1031, continuous non-invasive glucose monitoring device rental, including sensor and sensor replacement. So the answer should be S1031. What is the correct HCPCS code for flexible cervical non-adjustable foam collar? So you can check these options. So this foam collar will be utilized like it's a neck brace. Okay, and it will be like a soft foam material. So L0120 cervical flexible non-adjustable prefabricated. Okay, like it is already made. So answer is L0120. And next, what is the correct HCPCS code for service performed by qualified occupational therapist in the home health setting? So service performed by occupational therapist. Answer is G0152. G0152 service performed by qualified occupational therapist in the home health or hospice setting. Okay, 152 is the correct answer. So next, patient has an insulin pump of 100 units. Administration through DME. The pump is filled. Which code reports the supply? So here you can check the code's description carefully. J1815 is injection insulin per 5 units. So here they are directly giving injection. Okay, and then next J1817 is insulin for administration through DME, that is like durable medical equipment. So this is covered under the service of DME service. Okay, insulin pump will come under DME. So according to that, for this particular question, answer is C. Okay, J1817 with units 2 because it carries 50 per unit. So we have 100 units, so we need to give 2 units. Okay, if they specify only insulin injection, then you need to consider per 5 unit, then you need to select J1815 with units 20. Okay, but for this particular question, you can go with J1817 with units 2. Next, a patient with a malignant lymphoma is administered the anti-neoplastic drug rituximab and then a Benadryl. Which HCPCS level codes reported for both the drug administered intramuscular? So here both drugs are given through intramuscular only. Okay, so you can check this code J9312 injection 10 mg, J1200 injection up to 50 mg. So check the question and check the option between option A and option D. So J9312 into 80. Okay, since J9312 carries only 10 microgram, here they have given 800 microgram. Okay, 10 into 80, we will get 800. So this option is correct. And J1200 up to 50 mg. So they have given 100 mg. 50 plus 50, J1200 with units 2. Okay, and option D is, here they have given Q0163, so which is a oral drug. Okay, but here in our question both the drug are given through intramuscular, so that means injection. So we need to select answer as A. Option A is correct. Next question, what is the HCPCS level 2 code for Medicare patient wound closure using tissue adhesive only? So tissue adhesive only being used. Normally if you code for any kind of laceration repair which is closed with only adhesive, or we don't code any integumentary codes. Okay, so then if patient is Medicare and utilized only adhesive to close the wound, then we need to code G0168. G0168 wound closure utilizing tissue adhesive only. Answer is B. So last question, Medicare recipient present for an influenza and pneumococcal vaccination. So influenza vaccine Medicare, for the particularly Medicare patient, influenza administration code is G0008, that is G0008, and for pneumococcal G0009. Okay, so answer is C. We will select answer as C. Okay, so these are the repeated questions which I have got. Okay, and definitely 2024 also many of the questions came from these questions only. So easily refer these questions after your regular practice, and I hope you can secure 3 marks. Okay, so that's all guys for today, and please subscribe to my channel and share with your medical coding friends. Thank you for watching.